Mrs. Payne, it's Stacy again. So your doctor has ordered an IV to be started on you. So this is going to be a catheter that's going to go into your vein. I've got a lot of things, a lot of supplies I'm going to set down because I still need to verify who you are. Let me wash my hands and put some gloves on. So if you can tell me your name and date of birth. So Jane Payne, January 1st, 1960, great. And you're allergic to penicillin only. Okay, great. So Jane, I see that you're admitted for a small bowel obstruction and we have you NPO, so nothing by mouth, which means that you need some IV fluids, but we also need to draw some blood work from you. So I'm gonna start an IV on you. I'm also gonna collect some lab specimens from you. It's gonna be a little pinch in your arm. Do you have any arm restrictions? Have you had a mastectomy that I didn't know about in your history? No, okay. Any dialysis catheters, fistulas, grafts? No. Any lymph node removals? No. So it doesn't matter which arm I use, whichever, the best vein I can find. Perfect. We always like to confirm that because if there's certain arms we need to avoid, we want to do that. I'm just going to set up all of my supplies. So I have an IV start kit. It's called an extension tubing, but in nursing, we're going to call it a J loop because it's going to make a J. I'm going to need IV catheters. Let me just tell you, always bring 2. You're going to be more successful if you bring 2. These are 20 gauges. It says it on the packaging, and also universal colors. If I see pink on the catheter, that's how I know it's a 20 gauge. I'm going to need saline flush, and since we're going to be drawing blood, I'm also going to need some 10 cc syringes, and I'm going to need my lab tubes that have been ordered. If a patient has a BMP, basic metabolic panel, I'm going to need a green tube. If they have anti-coag or a coag panel, they're going to need a blue tube, so PT-INR, PTT. If they need a lactic acid level, they're going to need a gray top, and that's going to go on ice. A CBC, so my white blood cell count, my red blood cell count, hemoglobin, hematocrit, platelets. And then if we're doing any lab values, so like a Vanc trough or any of your antibiotic troughs or your psych meds, it's usually going to be a red top. So in this situation, a basic metabolic panel is the most common thing ordered, so I just need that lab tube. And I'm going to get everything set up. I'm also going to need a blunt needle in order to transfer that into that vial. I'm going to check and make sure the expiration date is good. This expires on 11/11/2029, so that is good. If I have multiple tubes to order, then I need to go in a particular order so I don't cross-contaminate my vials. I'm going to prime my J-loop by pulling the syringe back and then clearing the air bubble. And I'm going to attach this to the J-loop. So without touching this cap, I'm going to attach the syringe. It's a push and twist. And then I'm going to move the saline down to the end until I see some fluid come out, dribble, dribble. Perfect. And I'm going to just set that right there. This little cap is going to need to come off, but I don't want to expose that. I'm just going to loosen that and set that right there. I'm going to open up my IV start kit, which should have my Tegaderm. It's going to have alcohol swabs. It's going to have some 2x2s in case we get bloody. It's going to have my tourniquet. This is your Tegaderm. Now for newbies, I will say I would get that open and that backing off and out of the way. Some tape just off to the edge. This is your tourniquet. It is stretchy. Stretchy. So you're going to look at your patient's arms. If you don't see veins like this, which is not very common, you're going to need to put your tourniquet on to find a good vein. And you want to go 2 to 3 inches above where you think you're going to insert. So you may have to put the tourniquet on, so tension and a little half loop for a quick release. If I pull, that's going to be a quick release. And you may have to look for veins. Should feel bouncy, should not pulsate, that is an artery. Your tourniquet shouldn't be too tight that you lose your ulnar or your radial pulse, so it's good. And then once I have found that, I'm going to release that and finish setting up the rest of my supplies. So I have my J-loop ready. I have a 10 cc syringe. I have another 10 cc syringe. And we are going to poke this patient. So tourniquet back on. So I have all my supplies. You don't want to leave those on for long periods of time. It occludes circulation. I'm going to clean the arm for 30 seconds vigorously. And then you're going to allow it to dry. You don't blow on it. You don't wipe your hand over it. And for the mannequin, it's never going to dry because it's not real skin. For the real patient, it would be dry now. If you still see moisture, do not poke your patient because you're going to drive that alcohol into their vein and that's going to hurt. Now, please listen to my instructions. So you're going to anchor the vessel you're going to poke with your non-dominant hand by pulling it down. The bevel on the needle will be up if this little bump is on the top of that catheter. You're going to advance that by using your index finger. So you're going to grip the catheter with your thumb and your middle finger. And then your index finger is going to rest on the bump that's on that catheter. So non-dominant hand anchors the vessel you're going to poke down. You're going to go in at a 10 to 15 degree angle. You're going to push the catheter and you're looking for blood return in this chamber. Once you have blood return, you do not advance the needle any further. You're going to take your index finger and you're going to push that little bump forward all the way to the skin. Meanwhile, pulling your other two fingers back when you hear that click. You're going to take your non-dominant hand, release the tourniquet. Your non-dominant hand is going to grab the catheter. Your dominant hand is going to twist. Your dominant hand is going to grab the J-loop. You're going to connect the J-loop to the catheter. If it bleeds, do not panic. A bleeding IV is a working IV. You're going to grab those 2x2s and you're going to dry the skin around. You're going to grab that tegaderm and you're going to put it over the insertion site and the hub. You're going to remove the barrier or whatever this little section is called. You're going to flatten down your tegaderm. And at this point in time, I'm actually going to disconnect my saline flush. I'm going to connect a 10 cc syringe. I'm going to reapply my tourniquet in order to draw blood. I will aspirate back 10 cc's of blood, and this is going to get wasted because a little saline was already in the J-loop, so it will change the components of your lab draw. This goes into biohazard. I'm going to attach another 10 cc syringe, and as long as I am in control of this hub and don't let it touch anything, I don't need to re-alcohol swab, but I felt that hit my glove, so I'm going to re-alcohol swab. I'm going to attach my 10 cc syringe. I'm going to draw back only 4 mLs because that's how much I need in this vial. I'm going to attach this to the blunt needle. I'm going to take off my tourniquet because I have all the blood that I need. I'm going to poke that. The vial should automatically suck it up in there. If not, you're going to help it out a little bit. The needle and blood goes into biohazard. Your vial gets a little shake to get the additives going. Alcohol swab. Your syringe with your saline back on. We're going to clear the blood while assessing that this is flowing nicely. The patient isn't complaining of any pain. There's no signs of infiltration. I don't have any red streaking. And as I come to the end of my flush and I've cleared all of the blood, I'm going to clamp that J-loop. I'm going to come back to my tape and tape my J-loop down. And on this little border, there was a little sticker for me to date and time my IV, or you can just use a good old Sharpie, date and time that. and an IV and lab draw has been completed. I will label this with the label that they send for your hospital. This goes into a biohazard bag. And now we're just gonna clean up our mess. There should be no sharps anywhere on this. Anytime I had a sharp, it should have made it directly to that biohazard container. Everything here should just be trash. Mrs. Payne, you did wonderful. You have a 20 gauge in your left forearm. It is saline locked. I'm gonna come back on in a little bit and actually get your normal saline started at 50 mLs an hour. I'm gonna send off your BMP down to the lab. Do you have any questions at this time? Okay, wonderful, thank you. You did such a great job. That is not an easy procedure. I know it can hurt a lot. Great, thank you so much.